So this is our panel discussion. I thought it would be good if everybody just briefly introduced themselves, and then we just open up the session to questions. So.
Also, can I just say, if you have a child with Duchenne, could you say how old your child is? Because I think that will have a bearing on the experience you have.
Hi everyone, I'm Chloe Gagan, clinical psychologist based in Newcastle at the John Walton Muscular Dystrophy Research Centre.
Charlotte Wakelin, my son's Felix Wakelin, 10 years old. We're a family fund following Felix for Duchenne UK.
Hi, I'm Katie Coombs. My son Finn is 6 years old. He was diagnosed when he was 3, so this is my sort of third one of these, if that helps people understand where we are in our journey.
Alex Clark. My son Ben is 11, and I do some stuff with Duchenne UK.
Hi, I'm Janet Hoskin. My son is 24 years old, and I am chair of the Education Working Group for Duchenne Care, DMDK UK, sorry.
Hi, I'm Fleur Chandler. My son Dom is 18, nearly 19, and very involved with Duchenne UK on various things.
So, shall I open it up? Has anybody got any questions we want to ask the panel? We've got one.
Hi, I'm Tor. I'm a school nurse in Scotland. There's a child in my school that has Duchenne muscular dystrophy, and I'm keen to support in whatever way possible. I hardly ever see him because he's so well, and he's always playing football, and that's the only time I see him. But I see his sisters, and I want to be able to support them. Have you got any good practice that you can share with me, or support that you've received for the family?
Who'd like to? Who's got siblings? Maybe.
Fleur.
So Ben has a younger brother, and they were at the same school together, so they saw each other. Similar, at primary school, Ben was involved in maybe not be able to keep up with the other boys and his friends as well, but was involved in playing sport and that kind of thing. I think the key thing for us was making sure that Zach was informed. Zach's my younger son, was informed to. He used to keep an eye out for Ben, but also to make sure that school was as normal as possible as it would be for anybody else who had a sibling in that school. These kids feel different as it is, and even if right at this time the child with Duchenne in your school comes across as if you looked at them and if you didn't know you wouldn't know, don't for one second think they don't feel it inside. So making sure that both them and their sibling feel as though they're just another member of that school and they're supported, and is really, really important.
Fleur, and Janet, do you want to come on?
Hi, Saul, my son Saul, who's 25, has got 2 siblings who are younger, my daughter and my other son. They're both away at university at the moment, but when they were at home, the favourite phrase was, "It's not all about you, Saul," because they used to just get fed up with it all the time. And to be honest, I think giving them their kind of, thinking about their needs that doesn't, not always in relation to Saul, but actually they've got their own hopes and dreams and things they want to do. And I think that's really, really important that we sort of set aside time to actually do some things with them that, don't relate to DMD.
Yes, I absolutely agree. So Dominic has an older sister who's nearly 21, and she very often reminds me that she is a glass child, and you'll hear this phrase. So they're basically see-through and fragile, and I think I don't think she is a glass child, but it's quite a good term because you have to remember that they are there and that they're seeing what's going on in your family, and we got a lot of support from our local hospice. Because they have run siblings groups, so that was really useful, and also like providing counselling for the other child because they're missing out on things. I mean, Rowan, the daughter, would say, we didn't have trampolines, we didn't go on family bike rides, we didn't do the sort of holidays that other families do, and that all sounds a bit first world, but when you're 8, it's really, really important.
And how old was Rowan when she got that support?
So Dom was diagnosed at 3. So she was 5, and then we got support from the local hospice. We joined the local hospice quite early, which again I would recommend that you do, because children's hospices are not the same as adult hospices. They're really good places for support, and they often have these siblings groups. So she was in the siblings group from about age 6, and I think we found her counselling at school, which wasn't particularly helpful, but just gave her an outlet from about age 7, certainly in her infant school rather than her junior or secondary school. And just keep an eye on them, because there is no way that having this diagnosis in your family doesn't impact on them. It absolutely does. And particularly with the girls, as they get older, they could well be carriers as well. So you need to think about that and that sort of conversation. So I'm really glad you asked, because I think siblings are really, really important.
Chloe, do you have anything to add from a psychosocial perspective? Just while we're giving the mic, one little practical thing that so I've got 2 daughters, and my youngest one in her primary school, they knew all about Eli's diagnosis because Eli had also been at that school. And one of the teachers used to take Marnie for a walk every Thursday afternoon with the school therapy dog. And she loved that. I think just if the child knows that there is someone who they can talk to in the school who understands, I just thought that was a really lovely thing that they did. It was uncomplicated, it was easy, and Marnie developed a really lovely relationship with this teacher, and it helped her.
Yeah, I've got a couple of things as well. So a lot of places around the country run young carer groups, which are great to link in with, because a lot of the times it's kind of like activity based, and you get to meet other young people your age who are also siblings or carers of different kind of forms. And sometimes it can feel a bit weird using the word a young carer, but that's a lot of the times how a lot of our siblings kind of are viewed and the role that they do take at home. But again, that's a good opportunity to kind of link in from an emotional support point of view, but actually there's lots of going out to the cinema, going bowling, doing all those kind of fun activities. So there's the social aspect of it that way. There's the, going back to what people were saying, is actually sometimes just getting to spend some alone time with mum and dad is really important, and trying to carve that out, even if it's not always together, but just some sibling-specific time can be really, really helpful. And also just thinking as siblings get older, because we're talking there possibly both people in the school together, but revisiting, that transition to secondary school, of making the school aware when the sibling starts that this is going on at home. Not to make it that they're being treated differently in school, but sometimes there is that awareness, because when you hit teenage years and you're doing your exams and stuff like that as well, as a sibling, you're not a normal sibling where you're just cracking on with stuff all the time at home, which some siblings are, but it's just that there's the awareness as you get older as well, that you revisit it, not just in the primary school side of things. Yeah.
Got any more questions from the audience?
Can I ask
Emily,
Charlotte a question about, so do you mind me saying that your son was one of the first to be diagnosed, to be dosed with Jovinostat under the EAP, and I just wondered if you could talk us through your journey and who you engaged with and how you engaged with them to get your son access.
Yeah, sure. To be honest, I did everything you said to do.
I didn't pay her to say that.
as in, I contacted our MP, contacted the CEO of the trust, contacted our neuromuscular care advisor, wrote to the MHRA, did everything you said, and luckily I got responses from our CEO and our consultant, who acted fairly well, I now know very quickly. Which, I wouldn't say I've done anything particularly different to what probably anybody else has done.
And just talk us through how did the trust sort of engage with you and the other families to make sure you got access?
I think I did hound them a lot. I mean, I emailed, I was on the phone to the neuromuscular care advisor all the time. She probably got really sick of me. But they did communicate, obviously, every step of the process with us. I think it helps that we've got a neuromuscular care advisor, definitely, because she's really good. I think that's probably been a key to it, really, her communication. But the consultant's good. I mean, they held a meeting with all eligible families, which I think 6 attended. So obviously we are fairly small in Leicestershire. But they gave us all the information. And just a call from the pharmacy, and then we got it, which we were quite shocked that it seemed, I know it's not, it wasn't an easy thing at all. I know all the work they had to do behind the scenes, but I think we're just lucky, I guess.
I guess it's good that it's started now, and hopefully other sites will be able to follow.
Yeah, but if it wasn't for Duchenne UK and you saying what to do in the emails and giving me that process, I would not know, and what to do.
Katie, do you mind if I put you on the spot a little bit? Because do you want to just introduce your background and just give us a few thoughts on, because you did give us some really amazing advice on the campaign and how you think it went, and what do you think we could be doing more of, if anything?
Yeah, sure. So yeah, as well as being a mum to Finn, I've worked in sort of lobbying and policy and politics for a long time. So when I heard about the EAP and sort of got the initial response from my trust, which was sort of like, slow down, we're in the early stages of this, which I'm sure lots of you have had, I got in touch with these guys and sort of said, this feels like something that there should be a kind of campaign on. It feels like something that MPs and other people would, want to get behind, and it's that kind of emotive issue, and we should be shouting about it, basically, which you already knew, but just I wanted to help do that. And I think it is just about giving people those tools, because we're all very excited about this, and it's a way of empowering the communities to try and help the clinicians and everyone else who's fighting for it, and trying to use our stories and bring it to life, because I think these are human beings we're talking about, and I think it can get a bit, everyone here gets that and all the clinicians understand it, but it can all get a bit lost in the conversation that we're actually talking about, slowing down the progression of something and maintaining function and what that actually means. So I think putting a human face on it, and I think, you've done all of those things. You write to the MP, you speak to the trust, and it gets harder for them to ignore, it gets harder for them to not, progress it and put that pressure on it. So I'd encourage anyone who hasn't done it to do it. And I think, not all MPs are going to be very useful. My MP, ironically, has been totally useless, but I still really would suggest that you do it. I'm not going to name him because that would be unfair, but well, maybe. But no, try it, and go to the trust, go to your neuromuscular care advisor. Be annoying. I think that is the thing, and I think that's what I've learned in a career in lobbying, is like, if you don't shout and you don't say something, you don't get anywhere, and there's lots of organisations that don't do it, and you can tell the difference. So I think, don't give up, and if you are hitting a wall with your MP, there's other things you can consider, and try, and don't give up is the message, I think.
That's actually been the sort of guiding principles of Alex and I. Never take no for an answer.
I'll just add to that, bodies like NHS England and NICE and the government, they respond to evidence. So be evidence-based in your annoyance, which is really helpful, and that's exactly what Duchenne UK have done with this campaign and with your help, is to provide evidence that this is what you should be doing, and so shame them into it. But unless you have the evidence, that really fuels the being annoying.
But while you've got the mic, Fleur, can I just quickly ask you, so the first NICE meeting on Dravinostat is in July, and then we've seen from those slides that a preliminary decision will be announced in September. What's going to happen at that meeting in July? Can anyone watch it? And then when you talked about the interim decision, will that happen before September, or will that be what we get on September the 19th?
Okay, so the way that the NICE process works, it's supposed to take 9 months, so you think about it like as long as you would be pregnant for, slightly more painful. But in actual fact, it does take an awful lot longer than that. So what happens is the company write a submission document, hopefully using all the outputs of Hercules, which describe the condition, what difference will this medicine make to that condition in terms of costs, quality of life, and other morbidity and mortality effects. This submission is then reviewed by what's called an evidence review group, and there's about 12 of those dotted around the country. They usually come out of a university. So that evidence review group will look at all of that data and that evidence, and what the professor called the most boring book in the world. But they will look at all of that, and they'll come up with questions which then go back to the pharmaceutical company, who have to answer those questions. And they could be, we don't believe this assumption, we don't think that your modelling's right, or that we don't think that that clinical endpoint would lead to this type of progression. There could be all sorts of things. So those questions are sort of dealt with, and then it goes to what's called appraisal committee. So you have an appraisal committee meeting 1, and at that meeting, the NICE group will come up with a series of slides which describe everything that the ERG has found, so what the evidence review group has found, a list of key issues that they want to resolve. At that meeting, you have people from the evidence review group and then people from that NICE committee, and it's chaired by one particular chair, and there's 5 NICE committees, so it could be any of those, because this doesn't fall under HST, sadly. At that meeting, it will be discussed. There'll be 2 representatives from the pharma company there, and there'll be a patient, at least 1 patient representative and a clinician, so probably you. And the discussion will go around those key issues, and they will discuss those in camera. So you can attend that first bit. You have to look at, if you go onto the NICE website and say upcoming meetings, you can register as an observer. So you can register, but you need to do it at least 4 weeks in advance. You can't do it too close, so you could do it now. And then you can watch it. It's all done on Zoom. Then that decision goes back to then it goes into quite a private discussion with the NICE committee and the ERG. They write up their discussion, their decision. They'll communicate that to the stakeholders before it goes public. It'll either go straight to a final determination or it will be a draft one. If it's a draft one, then, like I say, it's usually a negative, so don't worry about that. And then it goes back to a final meeting. So you can have more than 1 committee meeting, and that is not uncommon. And the recent number of days it's taken for NICE to do a review is, I think they get 40% through in 240 days, which I don't think is particularly something to be proud of. So yes, you can register to go and see it. That's roughly the process. Did I answer everything?
Strongly urge everybody to sign up, because NICE need to know that we're watching.
Yes.
I mean, I know it's all about data, and we have done everything we can to give them the absolutely best data. We will put something out.
Yeah,
We'll
actually
go on the
planning
website.
a webinar with NICE to inform you on how you can input into the process. So do watch out for that when it goes.
Are we allowed to say who the patient representatives are? Or is that confidential? I'm looking over in the back row there.
I don't
We are
think
allowed
it
to
is
say.
confidential. So I'm one of them, and I actually was asked to do it alone as the caregiver of someone with Duchenne, but I've actually insisted that my son attends the meeting with me, because I think it's really important that they hear from Jack. He's 17. He's been on the drug for over 5 years, and they need to hear his lived experience of taking it.
I mean, listen, you couldn't have 2 better advocates. Really, you couldn't. I mean, Krish was very sweet today about listening to Eli speak on the BBC, but Jack is in a league of his own. I mean, he when they were speaking to Wes, he was mesmerised by them, and Jack was just so passionate about the unfairness of it and the guilt that he feels.
It's massive, the guilt that Jack feels, I think, is that Jack hasn't had to get involved in the Time is Muscle campaign. He has access to the drug. He didn't need to go and meet MPs and lobby for this, but he sat in front of Wes with Eli and Benjamin, who are his friends, and he said, I've known these boys since I was diagnosed at 4. They are my friends, and it is unfair that I get to take this medication every day. It is not a cure, it slowed down the progression of the disease for him, but why can't my friends have this drug that is available free of charge? And Michaela really well presented the challenges that the NHS is delivering it, but we need to find a way forward, and he is very passionate about, he just can't understand why the NHS is so broken and failing him.
Sadly, I think that's all we've got time for. So thank you very much to everyone. And that pretty much concludes the New Horizons 2025 conference, but I'm sure you'll be delighted to know that Alex and Emily will close with a few remarks.
just want to say a huge thank you to everybody who has come along we had the DMD Care meeting before this, all the healthcare professionals, all the patient representatives, everyone who has come to the conference. I can't tell you how much it means to us and gives us the drive to get up every day and do the work we're doing with Duchenne UK. But Duchenne UK isn't us, it's a collaboration between everybody, and you all give your time and effort to this patient organisation, and genuinely, from the bottom of my heart, I can never thank you enough for everything you allow us to do.
I've actually got nothing to add because that was a beautiful way to end the conference. So thank you all very much. Have safe travels. Thank you to our speakers, and thank you.